The Sioux Falls Eldercare channel is brought to you by Tony Mao and the great folks of Right at Home Sioux Falls. Today's guest is Michael Bankowski, owner-administrator for Prosperous Home Healthcare.
Hi, I'm Tony Mao, your host of the Eldercare channel here in Sioux Falls. And today with me I have Mike Bankowski. He's the owner of Prosperous Home Healthcare here in Sioux Falls. And Mike, why don't you just share with us a little bit about Prosperous Home Healthcare?
Sure. Prosperous Home Health's mission is to make a positive impact in the lives of the aging population right here in South Dakota. We feel that there's been a shortage in Medicare home health, and so we strive to make a difference. We build and create lasting relationships with their clients to make a significant difference in their lives through companionship, skilled nursing, therapy services, and through our medical social work services.
Oh, very nice. So on that services, can you give me a little bit of more information about each one of those services and how that impacts a person when you go into their home?
Sure. We our companionship services are really throughout all of our lines of business. So, but really the companionship is more on the non-medical side. Non-medical is not our focus in business. So we focus on the skilled nursing, the therapy services, and the social work side of it. We like to partner with other agencies in town on the non-medical side. But our skilled nursing, really, we can provide anything that a nursing home can provide when it regards to skilled nursing, except it's all in the comfort of our patient's home. So we can do anywhere from wound care, IV therapy, pain management, specific cases that we can work with, stroke patients. We can work with their speech. We can work on their eating, different surgeries, post-surgery rehab. We can use therapy services really for anything, whether it's a knee, a shoulder, wrist. There's really a therapy service that we can provide. We also, part of our program is a fall assessment program. And so we'll come into your home and we'll analyze, we'll figure out, what type of risk are in your home to fall risk, and we'll come up with a fall prevention program. And all of our skilled nursing, our therapy providers will kind of use that program to best suit you so that we can reduce falls in the home.
Yeah. So if mom is coming home from a rehab stay and she's using a walker or a cane, you don't want to throw a rug at the front door.
Right. Exactly.
Yeah. Okay.
And that's the beauty of having therapy services in the home, is that we can see all of those risks that the patient is dealing with on a daily basis.
Yeah.
And that's what's so great about services in the home, is that 70 to 80% of the time a patient's going to be in the home, and those environments, those risks are exactly what we're working with. For example, if we have a patient that we're providing services for that maybe had a shoulder replacement, and they have a favorite lazy boy chair that they like to watch all their shows from, but they're having difficulty getting up and out of that chair, and maybe even getting into that chair.
Yeah.
Well, we can work with that specific chair on maybe a different method, maybe a different way of getting out, so that it takes less stress on the shoulder. And then we can work on specific strengthening of the shoulder for that very purpose. And so we're putting purpose with a plan to get an outcome.
Very nice. One of the things that we haven't talked about is maybe some of your funding sources. If a person needs therapy in home, how would those services be paid for? Okay,
so if the patient's eligible for Medicare, which we are a Medicare agency, the beauty about Medicare home health is that 100% of services, including therapy services, are all covered under Medicare, which means zero cost to the patient. The facts are that South Dakota is behind the curve when it comes to Medicare home health. We are the second lowest state in the nation for utilizing Medicare home health, which means our Medicare per capita rate is much higher than other states. And so that's the number one benefit, is that there's zero cost to the patient when using Medicare. Now there's also other insurances that we accept. We really accept all insurances. We're able to accept Medicaid as well, and long-term care insurance. And so using all of those packages, it's going to be a very small cost to the patient.
Okay, very, very nice. Is there anything that your company does maybe just a little bit differently than others around?
You know, one thing that we do that I feel is very important with is that we employ medical social workers, and medical social workers come right in the home, talk about certain mental or social issues that the patient may have, and really sets the ground for improving outcomes, and establishing those goals, and reaching those goals more on a personal, mental level. And so that's one thing that I felt was a underserved market in Sioux Falls, was utilizing medical social workers, and they are an excellent resource to help the patient get to be where they want to go.
That sounds like a great idea, and if I'm understanding this right, you're helping the same person with their physical therapies or their OTs or their STs, as well as just their mental well-being.
Right. It's the holistic approach that we look at. That we're gonna help on the physical side, but we're also, if there's any issues, we're gonna help on the mental side. And the nice thing about Medicare home health is that medical social workers are also covered under that. So to the patient, it's zero cost, and we're able to look at it as a holistic approach.
Oh, that's very, very good. Well, Mike, I want to thank you for taking time today to come here. And on behalf of the Eldercare channel, it's Tony Mao and Mike Bankowski signing off for the day. Thank you very much.